Malathi Srinivasan, clinical professor with Stanford Healthcare. Thank you so much for joining me today. So first question is indoor mask mandates. Various counties have released guidance to drop the indoor mask mandates. In your professional medical opinion, do you think it's time, or would you prefer to see them in place, especially since younger children are still unable to get the COVID vaccine?
Christine, dropping indoor mask mandates right now is incredibly premature, especially as we're coming into the holidays with more people going out and gathering. And I wanted to do two things. One is put this in perspective. And second is talk about some tangible milestones we need to reach to be able to even consider dropping a mask mandate. So the perspective is that the Delta variant, which, as you know, is now the dominant variant of the US, is extremely catchy, and it's so much better to be safe than sorry. And we don't know what other strains are going to be following behind this one. We also know that immunity is waning for people who are older or immunocompromised. And with increased holiday travel, there are going to be people coming in from all over the country, all over the world, who can very unknowingly bring infections with them. I mean, no one is deliberately trying to get other people sick, but there's a long latency before people do get sick. So it's very easy to pass this along. Plus, children are reservoirs of infections and can pass this to others. So we need to make sure our children are vaccinated, the 5 to 11-year-olds, and this hasn't happened yet. We don't want them to infect their grandkids, or their grandparents, or the rest of their family members, or people who have hidden illnesses, like someone having cancer chemotherapy, and you don't even know that they're ill. So we also need to meet a lot of external milestones to be able to drop the indoor mask mandate. So first is we need to be in a yellow transmission zone for at least 3 weeks. This is having an infection rate of about 1 to 10 per 100,000 people. And right now, California, we're at orange with 13 infections per 100,000. It's not enough. The second is the hospitalization rates need to be very low and stable. And this lags behind the infections by about a month. So it's way too early to tell. And the third, while the 80% immunization rate, which we thought would give us appropriate herd immunity, was our initial goal, because the Delta variant is so catchy and the immunization is waning, we need to actually probably do much better. And, in California, we're close to that 80%, 71% of people are fully vaccinated, 8% are partially vaccinated. And the good news is that we've got 5 million doses of vaccine on hand. So really, to drop the indoor mask mandate, we need a strong dose of common sense. Even the CDC has just recently recommended that vaccinated Americans wear masks indoors in areas with high COVID transmission rates. And I'd argue that being in an orange zone is high enough.
A top FDA official says those 18 years and older should become eligible to receive the COVID-19 booster shot. What does the latest evidence show? And could booster shots be beneficial to a greater part of the population?
So, Christine, we've passed a very grim milestone. We've had 700,000 deaths in the US from COVID alone. And the goal of vaccinations, as you know, is to prevent severe illness, hospitalization, and deaths. Right now, the data supports giving vaccination boosters, which is an extra dose to boost your immunity or help you achieve primary immunity if you didn't do it the first time, to anyone who's immunocompromised, either by a medical condition, who are over 65, or who are in high-risk professional settings. And the data shows that immunity wanes for COVID-19 vaccines, including the mRNA vaccines, around 6 months. And this becomes clinically meaningful when people start to get sick. So who's getting sick? Based on studies from Israel and other countries that are ahead of us, and also a new study from the CDC looking at about 4,000 people in nursing homes from March to May in comparison with June to August when Delta came out, shows that these are the groups. First, people who are 65 and older, people who are 18 who live and older who live in long-term care facilities, anyone who's 18 and older who has an underlying medical condition, and this is everything from asthma to cancer to things that impair your immune system, addiction, being overweight, for instance, or obese. People who work in high-risk settings, this is teachers, anyone in a public setting, in a healthcare setting, and people who live in high-risk settings, not just work in high-risk settings. So that's a lot of the population. And we need to get our kids vaccinated because kids live in multi-generational families with their parents and sometimes with their grandparents. So if you are around any of these people, you also should get vaccinated. So I think that we are going to see, so I think that we will see an increase in the number of booster shots being given. We're very privileged that in this country we actually have vaccine. We know worldwide distribution is a really big issue. And there's an argument that people who are not at high risk or not around people who might be at high risk and can pass it along to others should not get a booster. But that's based on the idea then that those extra doses will go to those other countries, which I'm not sure is quite the case. So we do need to get the world vaccinated, but we also need to make sure that the people who are vaccinated stay safe.
Sweden is pausing use of the Moderna vaccine for anyone under 30 due to rare side effects of the heart. How serious is the health concern there?
Christine, the inflammation of the heart is called myocarditis or pericarditis, and it's a really rare side effect. And we have to balance the risk of getting heart inflammation from COVID with heart inflammation from the vaccine. None of these vaccines are risk-free, but the risk level is very low. So after vaccine, the number of people who get inflammation of the heart is about 1 to 5 per 100,000. But here's a kicker. If you get COVID, your risk is 2 to 3 times higher at about 11 per 100,000. And this is based on 2 large studies, a careful Israeli study with about 2 million people, vaccinated, unvaccinated, had COVID, didn't have COVID, who got followed for about 42 days. And also some other studies from the US. Now, the issue that Sweden is responding to is that on a subgroup analysis, the studies seem to show that for young men about 12 to 30, the risk of myocarditis goes up to nearly the COVID rates after their second dose. So the question I would ask is, which risk do you choose? I personally choose getting the vaccine and a booster in a heartbeat because the side effects of severe COVID are much, much worse than the mainly short-term effects of the vaccine. So what do I mean by that, right? So there was a New England Journal of Medicine study that showed that the vaccine protected against a lot of adverse events, acute kidney injury, pulmonary embolism, which is a serious blood clot to the lungs. Acute kidney injury is like 125 events per 100,000 of people who were infected. Pulmonary embolus, like 61 or 62 per 100,000. Deep vein thrombosis, 43 per 100,000. And also heart attacks, pericarditis, and myocarditis. Intracerebral hemorrhage and thrombocytopenia, which is low platelet counts, not to mention that people are getting long COVID syndrome. So if I had a choice between getting a native infection with COVID and chancing whether to have the risk of all of these complications versus some of the very rare side effects from the vaccine, I would choose the vaccine.
And with the number of COVID cases falling, especially in parts of the Bay Area, do you think we're finally nearing the end of the pandemic? Or do you think we could see another surge or another dangerous variant?
Yeah, so the pandemic will clearly end at some point, but when is not clear. So in my personal opinion, I think that the Delta virus surge will probably diminish sometime by spring or summer. But until the world is vaccinated, there's a real risk that another virus will mutate and travel to the US on some unsuspecting traveler. So the overall test positivity rate has gone up over the past couple months, and it seems to be stabilizing a bit in October. It's about 6.5%, varying by county and vaccine status. During this most recent wave, we had 143,000 cases per day, and it's kind of dropping a little bit, about 100,000 cases per day. So in the short term, I think it depends on not letting our guard down and still being careful. Masking, vaccinations, and social distancing are our 3 best tools still. But my concern is with the holiday season coming up, Halloween, Thanksgiving, Christmas holidays, I think people are have pandemic fatigue. They're just not as careful as they need to be. And we would hope that we would have learned our lesson by now, but we'll keep our fingers crossed that the next surge doesn't come through. And in the long term, I'm really hopeful that oral agents like Merck's molnupiravir will become part of our arsenal against this virus. There was an interim analysis of about 700 people that Merck released that showed that this oral antiviral, which is our first outpatient oral antiviral, showed that it reduced the risk of hospitalization and death by about 50% compared to placebo. So from about 14% to about 7%, but 7% still. So it's not a magic bullet. We still need the vaccines, masks, and appropriate social distancing.
We'll have more news and weather coming up right after the break. You're streaming CBSN Bay